Heat stroke is the most severe heat-related illness, defined by a body temperature over 40 degrees Celsius or 104 degrees Fahrenheit, and associated with neurologic dysfunction. This is a medical emergency with a mortality rate as high as 40%. Symptoms include altered mental status, possible seizures, and hot, dry skin, known as anhidrosis. Core body temperature is over 40 degrees Celsius, though rectal temperature may be lower. Other signs include jaundice 24 to 72 hours later, and cardiovascular dysfunction like hypotension and pulmonary edema. There are two main forms of heat stroke. Classic or non-exertional heat stroke affects sedentary elderly, chronically ill, and very young people. Exertional heat stroke generally occurs in young individuals engaging in prolonged strenuous activity in a hot environment. Diagnosis involves blood work, including a CBC, electrolytes, LFTs, lactate, and blood gases. Immediate treatment requires calling EMS, moving the victim to a cool, sheltered place, and removing excessive clothing. Cool the victim with cool running water and ice packs in the groin and armpits. If conscious, give sips of cool water. If unconscious, turn them into the recovery position and be prepared to perform CPR. In the hospital, doctors assess the patient's ABCs and provide supportive therapy, including continuous temperature monitoring and correction of electrolyte imbalances. Rapid cooling methods include removing clothing, evaporative cooling by moistening skin with tepid water and fanning, or cold immersion. Adjunctive treatments involve placing ice packs on the groin, armpits, and neck. If refractory, other methods, like gastric, pleural, or bladder lavage, may be applied. IV benzodiazepines or paralysis may be used to prevent shivering, which generates heat, and to treat seizures. Intravenous fluids are administered to maintain a CVP of 12 milliliters, or a urine output of 0.5 milliliters per kilogram per hour. Dopamine may be used for persistent hypotension despite adequate fluid resuscitation. Dantrolene, a muscle relaxer, is used if malignant hyperthermia is suspected. Avoid antipyretics and prophylactic steroids as they are not effective. Also, avoid norepinephrine, which causes vasoconstriction and decreases cutaneous heat exchange. Poor prognostic indicators include a coma, a delay in rapid cooling, as morbidity and mortality are proportional to the duration of hyperpyrexia, hypotension, renal failure, and lactic acidosis. Immediate cooling should be initiated with ice water immersion. Other methods include evaporative cooling, using large circulating fans and skin wetting, and applying ice packs to the armpits, groin, and neck. Internal cooling methods are rarely used. The average intravenous fluid need is about 1 liter per hour for 4 hours, using Ringer's lactate or saline. If hypotension persists after cooling in fluids, insert a central line. Use vasopressors with caution, as vasoconstriction may hinder heat loss. Output should be monitored with a Foley catheter and temperature with a rectal probe. Risk factors for heat stroke include strenuous activity, age, dehydration, and certain medications. Complications can include ARDS, electrolyte abnormalities, renal failure, rhabdomyolysis, hepatic injury, and DIC. If left untreated, heat stroke can lead to cerebral edema and multisystem organ failure. Frostbite is damage to skin and tissue caused by exposure to freezing temperatures. Anyone who works or spends time outdoors in cold environments is at risk. Frostbite is split into two categories, superficial and deep. Superficial frostbite freezes only the top layer of skin and may cause blistering. Deep frostbite freezes underlying tissue and can cause permanent damage to the skin and muscle, with risks of infection and requiring surgery or amputation. Symptoms of superficial frostbite include numbness, swelling, and blistering of the skin. The early stages can be easily missed because the initial symptom is numbness and loss of sensation. Deep frostbite symptoms include blue-colored skin, hard black skin, and the formation of an ulcer. First aid for frostbite includes seeking medical assistance, as rewarming is painful and may require strong painkillers. Monitor for hypothermia and move the victim to a warm, dry, sheltered place. Remove constricting items like watches and rings before swelling occurs. If prompt medical help is unavailable, only consider rewarming if there is no risk of refreezing. Rewarm by placing the affected area in warm water between 99 and 103 degrees Fahrenheit for up to an hour until color and sensation return. Protect the area with a sterile dressing to prevent refreezing. The references for this video include First Aid for the Emergency Medicines Boards in the chapter on environmental emergencies and the Complete First Aid Pocket Guide.